we are speaking.
Yes, yes. Go
Yeah,
ahead. Yeah.
thanks for giving permission, Mr. Jibin.
No, go ahead.
Myself,
Thank
Santosh, research coordinator from Innovative Labs for Public Health, and we are
Okay.
glad to have you today for our discussion to know your opinions and your experiences working in India and currently working. So let's start with your introduction, please. Can you introduce yourself?
Yeah. Hi. My name is Jibin. I'm a registered nurse. Currently, I'm working in Ireland. I'm working as a registered nurse in Ireland. Before coming to, I'm an Indian citizen, so I was working in India before coming here.
Mhm.
Yeah.
Uh, uh, how many, when did you complete your BSc nursing and where did you work in India for last, when you were there, before coming to New Zealand, Ireland, sorry?
Ireland. Yeah. Yeah.
Yeah.
So I actually graduated. I'm a BSc nurse, so I graduated in 2018 from Rajiv Gandhi University of Health Sciences. So after that, I was working in some of the private hospitals for a few years. Then I got an opportunity to join All India Institute of Medical Science, Delhi. So I was actually working there before coming to Ireland.
Oh, you're working in All India Institute of Medical Sciences, New Delhi. That's one of the prestigious
Oh,
institutions in the country. Yeah.
yeah, I really got an opportunity to work there. Yeah.
How many years did you work and can you tell us in which area you worked?
I was there for almost 5.5 years. I was in Jayaprakash Narayana Pax Trauma Center, which is a part of AIMS, and I was working as a nurse there in neurosurgery ward.
Oh, neurosurgery ward or neurosurgery ICU it was?
I was in ward actually, neurosurgery
Okay.
ward.
Okay.
Yeah,
Excellent. Means you had a patient with a polytrauma patients and head injury. Or?
definitely polytrauma patients who has a head or spine injury usually come to us in
Mhm.
neurosurgery ward.
Yeah, that will be great. My next question is, what are the procedures or the nursing care which you used to do independently by yourself being a nurse? That's the first question.
Okay,
Second question, how many patients you used to take care of during your each shift?
okay,
And what are the let's say procedures you used to do with the interdisciplinary, that's you and doctor together? Can you
okay.
explain us in 2 minutes, please?
Oh yeah, definitely. Basically, nursing care, that was, as a nurse, that's the first most important thing for us to do in the ward. So we always give importance for that, like to make our patients clean, hygienic, and meet their needs, whatever they are in need. Like, so basically assess the patient's needs. So just for an example, I can tell you, like, we do a head to foot assessment in the ward initially when we are taking the handovers, and then we know like what the patients need, if they need an eye care, if they need a mouth care, if they need a tracheostomy care, if they need a catheter care. So if they
Mm-hmm.
need their demands like eating, drinking, eliminations, walking, mobility. So based on that, what they need, that was we were supposed to do, and we were doing the same our own way. Yeah. But again, coming to the procedures, I can tell you, like, All India Institute of Medical Science, it's a big institute. Like, there are lots of interdisciplinary members over there. So
Mm-hmm.
when you ask me, like, what we do independently, it's a tough question for me. Like, I can definitely tell you, like a patient who was there for a ride, like, who needed support for feeding, like NG tube or Riles tubes, like, I don't really know was I supposed to do that, but I had done many.
Yeah,
Yeah,
okay.
I had done many really. Like I couldn't wait for doctors. I was told from my boss, like, that is supposed to do by doctors, like the
Okay.
junior residents. But I couldn't definitely wait for them for doing them. Like, I didn't want to starve my patient for a long, and I had done many. But still, I don't know. Like, if you ask me, was I supposed to do that? I don't know. Is that my
Okay.
work? I don't
Yeah,
definitely
that's
know
interesting.
about
I
that.
you are telling that you used to do into that nasogastric tube into the feeding one,
Yeah,
and
yeah,
according basic added to basic care. Second was you were also doing the tracheostomy care. Am
yeah,
I correct?
yeah, yeah.
When you do such program, were there any chances to write in the nursing documentation that you have done and did with signatures?
We do, like, the nursing notes what we were using in names. There was a space like to write down like what we have done. So
Mm-hmm.
just in a simple terms, like simple sentences, we usually do that.
Okay, that's great. Do you think any currently in Ireland you are also working in same department or it is a different?
I know I'm working in same department, neurosurgery ward.
Oh, what are the procedures you are supposed to do there? Are the same or is it different setup?
No, it's almost the same. The hospital is like, the setup is almost the same like AIMS. This
Oh,
is also a tertiary institution. So again, the disciplinary members are like in the same junior doctors, senior doctors, the consultants, again nurses, and so almost the scenario is same. But I'm more independent over here. I know what I am supposed to do. Like I know what is my limitations. I know what is my scope of practice here.
okay.
So if I want to go for an NG tube, I don't worry. Like I don't need to wait for anyone's permission. Like if I need the patient is need of NG tube, yeah, definitely I can contact the dietitian to come down and write for some formula like what the patient needs. So now I can put an NG tube and I can start it over.
Okay,
Yeah,
that's
I don't
nice
need to
to hear.
wait. And if I feel the patient is in retention, if the patient is having some problem with the eliminations, I don't need to wait for anyone. I can put a catheter in if I'm really pretty sure. Like that's scope of my practice. But I know like what is my scope of practice over here.
Okay, thank you, Jitin, for explaining the same. I am very glad that you could able to work India and abroad, the Ireland, same situation. And glad to hear that the settings are same. That shows uh, the tertiary care in AIMS and trauma center is provided as equal to an competitive developed country in the world. So next question is, do you think what the nurses in India who are working in such situation, let's call it as a patient who is who has a neurological trauma, who has accident and has a neuro trauma, and is in the ward, and nurses could able to the nurse who is working in the Indian setup in such ward can able to called as can we consider them, can we give them a skill based uh, suppose called as 5 years he worked, then let's have an examination, provide him a space called as ICU nurse, then again after 5 years give them a specialty and call them as a clinical specialist. Is it makes a sense in Indian situation to improve the quality of care?
That's a that's a big question. Like I do have a lot to tell about it. Like it will take a long time, but I'll try to make it very short for
Yeah.
me. Like especially in a neurosurgery department,
Hmm.
when your patient is so dependent on you. Like I'm first contact of my patient. I'm proud to say
Okay.
always that. Like as a nurse, I'm the first contact of my patient, and I know I'm supposed to know what's the need of my patient, and they tell me like what they need. They don't go for anyone.
Hmm.
They call nurse, come on. So
Yeah.
that's first contact. So I should know what they need. And again, coming to the point, like so being 5 or 6 years experience in the neurosurgery ward, like when they call me, some of my patients, not some, like many of my patients, especially after the head injury or something, like they won't be able to express what they exactly need. So
Yeah.
it's my duty, like I should know what they need. So by seeing maybe from the few words, like from few words they speak, or the expressions what they have, or like the if they're restless, if they're moving around, I do have, I don't say like exactly I can understand what they need, but I do have some points in my mind. So if I like one, two, three, four, five, so I can tell you like it could be five of those, because
Okay.
of my experience, the long experience in neurosurgery ward. So what do I mean to say? Like I always experience, like for an example, I can tell you the incident that happened last few days back. Like the patient's pressure was going up about 170, 170, 80. He was tracheostomized person and recently put his tracheostomy out. I mean,
Oh.
like he is weaning off from the tracheostomy, but he is still not able to speak. And his
Hmm.
pressure, like previously he was normotensive. He didn't have a hypertension or any histories in that way, but his pressure was continuously going into 170, 180 systolic. And yeah, what I have to do, like the same, I had to call my doctor, the junior doctor. So he came down to ward, and um, he was wondering like should he give some antihypertensive, a stat dose or anything to reduce his pressures. But I was sure like there's no need for giving an antihypertensive or anything, like so there could be a point, a stimulation that is keeping his pressures high. Yeah.
Okay.
So I had my 5 counts. So I told him, like, see, look, if he's in any pain or anything, like if something is causing him discomfort or in distress, look his
Exactly.
bladder, look his bladder, if he's in retention, look his bowels, if he is constipated. Yeah, definitely. So it was the particular incident was because of pain and because of he had a small bit of sore in the bums, and that was causing his pressure high. So we gave him a start
Oh,
dose of a good pain medications, and definitely the pressure came down.
okay.
Yeah, because the new doctor, he was new, like, he was in the neurosurgery department for just for 6 months, and he couldn't know that because just because of experience, he couldn't know that the reason for his hypertension. So because of my experience in a particular ward for with the same kind of patient for few years, like I could know
Yeah.
what was happening with him. So in that way, especially, a patient, a staff nurse with years of experience could definitely, like, they can be very faster, like, in seconds they can find out the reasons for many of the issues. I don't say like everything, but still many of the issues. So which will definitely, contribute to the improving of the patient care. That will definitely help the patients to get more comfort.
So what I understood, the case scenario which you gave right now, it is happened in the Ireland, or it happened in India. The case scenario, what you
No,
said?
no, no. It was just about an issue happened in the Ireland.
Okay,
Yeah,
that's good.
I
It
told you about
means,
this. Like the situation is just the same, like in India, in Ireland, about the setup.
yeah.
The first contact is always junior residents there as well and here as well.
Okay.
Yeah,
If I comprehend correctly, you mean to say that if nurses who have been experienced in a particular ward
yeah,
and have a lot of experience there with a kind of theoretical input, let's say continuing nursing education for only intensive care, can improve their skills with knowledge, and we can certify them as a uh, intensive care nurse as a first stage. Then again more certification with a more input. Can we call them as a intensive care nurse specialist?
yeah. Definitely, like, but there can be some certain limitations. Like they won't be able to do any each and everything for the patients in the intensive care unit. But there are few things like they can independently work with the
Mhm.
patients.
For example, you said the intubation care which we do it. One of the best example.
Oh yeah, definitely, definitely. Yeah, yeah. And
Oh.
again, I just again coming back to AIM the previous days, like, there was a cadre called trauma nurse coordinator. That
Mm-hmm.
was I was very much like to say interested in that cadre because when I saw about their plans and everything, like it was really a very good plan, like trauma nurse coordinator. They were them, like, the patient whoever come to hospital from A&E until they get discharged. So they were managing the patient's needs and everything. Like I don't see that they come to patients and see what the patient's needs, but I say either if the care is going in the right way, if everything going in a progressive way, like, since the day of admission till they get discharged, they had an eye. That was the plan initially, but I don't know like how that's working. To be honest with you,
Yeah.
but the plan was awesome. It was really what to say about that. Like it was really brilliant.
Okay.
Yeah.
Are
So
the nurses are the same cadre of nursing cadre, or they are called a special cadre of trauma nurse coordinator certified,
trauma.
and the institution is providing saying that they are cadre called nurse case and it's certified by institution, or what?
I don't basically know about it's a certification. I don't think so. They have any certifications or anything that way.
Okay.
Like, but in trauma, I mean JPNAC, NATC, Jaipur National Post Trauma Center, there was a cadre called. There was a special cadre called trauma nurse coordinators. They were also nurses, like whoever come in the regular way, regular recruitment, and they were
Okay.
selected as trauma nurse coordinators. But their job profile was excellent. I don't know, like, how it practically worked out, but the job profile was excellent.
I think it will be good if the same nurses could have been given a designation called as trauma nurse care coordinator after the 5 6 years for experience, and they could have done a marvelous job. Do you think so?
Definitely. I was so much I was so much excited about that profile. A patient coming to hospital, so they know what the patient's issue and what are the basic complaints. And then few days after, like they are checking with the patient. The patient might be going to A&E to ITU, then from ICU, from ICU to some other ward, but they are following the patient, like,
Yeah.
so these were the issues when the patient came down, and that the where they sorted. is it
Mhm.
sorted or not? Then if it is not sorted, why it is not sorted? So they are making the, if it is a, suppose if the patient is having any kind of surgery interventions to be needed, if the surgeons are not seen, why he is not seen, so they are making arrangements for the surgical consultation to come and see him. And if there are any other issues, like why it is not solved, so who to be contacted, so they are making a plan for the patient for discharge. That
Okay,
was a
that's
profile, and that was awesome.
yeah.
Yeah.
So thanks, Jibin, for spending a 15 minutes. What I understood from your understanding is that number one, the nurses who are working in the special areas where a lot of need is there in our country, where it is developing country. Let's also call as people say low and middle, low income. What happened to me? Low and middle income countries like India, where health such care is required, where nurses are trained, they have a lot of experience with a additional continuing education, and a nomenclature called skill-based nomenclatures can increase their motivation and spirit to come out and care, and it also improves the quality of care that you very clear. Second, you suggested one of the best uh, care, which are trauma nurse coordinators, which are there in trauma care center aims as a module who take a case management from the day one. They come into the hospital day last day where they are discharged, and follow up too they will do, right?
There was a plan, like with the,
Yeah, yeah.
yeah,
I think
the doctors.
such kind of nurses, if they have a special cadre called as nurse trauma centers as a designated, they'll do a marvelous work, and it will improve the
Yeah,
quality of
when they are
care.
independent to do them, like if they are their profile, like if if they are really skillful, and if they are really talented, and if they are, what to say, devotive to that, they'll definitely do marvelous things.
Okay, that's nice to hear,
Yeah.
Jibin.
Yeah.
Thanks for your time, and all the best. See you some other time in India.
Thank you, Santosh. Thank you so much. We'll see you later. Yeah.
See you.
Bye. Take
Bye
care.
bye.
Yeah. Bye bye.